when we think of hospitals and healthcare, we typically think of physical health, like we were mentioning,
Mhm.
like Kevin mentioned with the flu and things like that. But how important is for you guys to get out word about like things like mental health for someone's overall well-being?
Yeah, so mental health is near and dear to my heart. I actually lost my brother at the age of 16 to suicide. So when I
Mhm.
took this job at Oswego Health, we are huge advocates in that space. We have the largest mental health inpatient unit here in Oswego called the Lobdell Center for Mental Health and Wellness, as well as two outpatient centers. And so health is the whole person. It's not just the symptoms that you are portraying. You're complaining about an earache, a headache, a broken arm. It's also what's happening on the inside as well too. So we are very, very huge on advocating for mental health. It may not be something that is visibly seen, but we all at some way or another are dealing with mental health. So we are very much advocating for that. We encourage everyone to seek help, to talk to others, and simply be kind. Kindness can go such a long way. I always say that you never know what someone's going through. And by simply opening a door or maybe saying what you're thinking, you see someone and they look nice, compliment them because that's going to resonate for hours or days. So if you can't necessarily fix someone, but you can be kind and empathetic, you could be just as powerful and helping with someone's mental health.
And how do you go about, first and foremost, let me say I'm sorry to hear about your brother, but and first, how do you go about getting out word about mental health and things like that?
Yeah, so we have, like I said, three centers here in Oswego County, but we treat patients from all over that will come to us for mental health, inpatient and outpatient. And so we are working in schools. We have school-based counselors, so we're
Mm.
starting really young and advocating for their voice and for them to be comfortable sharing, so reducing that stigma. We often sponsor community events, or we'll go and we'll table and just be advocates in that space. And then through all of our facilities, including our primary care, as part of screening, when they come to a primary care provider, we're asking, kind of just a pulse on their mental health and if they feel like they need to talk to someone and how things are going. So, again, reducing that stigma and just being that resource for the community.